Good day everyone, we have different types of braces. The first one is the prophylactic knee braces are designed to prevent and reduce the severity of ligamentous injury to the knee. It is commonly designed and used by athletes who play contact sports such as football. Next is the functional knee braces used to provide support to knees that are already injured either from playing a sport or a fall. It is also great for reducing rotation following an ACL injury or tear, and for those who need additional support after ACL repair surgery. In some cases, they can also be used to support mild to moderate PCL or MCL instability. Next is the rehabilitative knee braces. It helps in limiting potentially harmful knee movements while a person is rehabilitating after a recent knee surgery or an injury. This type of braces work to protect a reconstructed or repaired ligament and allow early motion of the knee joint. It is also a great tool to protect the knee joints and ligaments to prevent for future or recurring injury. The next one is unloader offloader knee braces are designed to provide relief to people who have arthritis in their knees, specifically individuals who suffer from medial compartment knee osteoarthritis. It is also designed to unload stress from the affected joint by placing pressure on the thigh bone. This forced the knee to bend away from the painful area. This brace, such as our OA knee braces, can also be helpful for people who are waiting to have knee replacement surgery and want to take stress off their knees beforehand. Next is the Boston brace. It is typically made from one of several fabricated mold options. After the orthotist, a person making the brace, select the mold that best fits the patient's size and curve type. Corrective pads and trim lines cutouts are strategically added to the brace by following a blueprint specific to the patient's scoliosis curve. It works by applying corrective pressure on the convex outer side of the curve and cutting out corresponding areas of relief on the concave inner side of the curve so the spine can migrate in that direction. The brace open in the back so the patient may need help getting into and out of it. Another common TLSO is the Wilmington brace. However, unlike the Boston brace, the WB is custom fitted based on a cast taken of a patient while lying down, facing up. After the cast is made, corrective forces specific to the patient's spinal curve are added before the brace is completed. This brace goes onto the body similar to a tight jacket and is known as a full contact TLSO due to its lack of gaps or open spots. Next is Milwaukee brace, which is the original cervico-thoracic lumbar sacral orthosis or CTLSO invented in the 1940s. Is an older and bulkier brace due to the effectiveness and relative convenience of today's more modern brace. The Milwaukee brace is rarely used anymore. However, it is still sometimes used for curves higher in the thoracic or cervical spine. Charleston brace, designed to be worn by scoliosis patient only while sleeping. This brace is asymmetrical so that it exerts a force that overcorrects the spine during the night to help it grow straight. Next is the soft spinal brace. Are made with soft breathable fabric and adjustable elastic or Velcro closure. Soft brace compress the abdominal region and relieve pressure from the spine by supporting the muscle that usually need to hold up the skeletal structure. It is also allow for forward motion of the spine. Some soft braces are designed for support while the wearer is engaged in heavy lifting at work or at home. Other just provide lightweight, all-day support. These orthotics come in different shapes and size depending on the area of need. Some extend from just below the chest to the hips. Other narrower ones resemble a large belt. Next is the rigid spinal brace are designed to provide support following an injury or surgery. Plastic parts are placed over the lower back and stomach and are attached with Velcro straps. In addition, most scoliosis braces are the rigid type and are designed to prevent further curvature of the spine as retains and thins and grows. Sterno-occipital-mandibular immobilization device, or SOMI, is a brace that holds your neck in a straight line that match up with your spine. It offers rigid support to a damaged neck and prevents the head from moving around. With this brace, you are unable to bend or twist your neck. The restriction of motion helps the muscle and bones to heal from injury or surgery. Rigid cervical braces are typically used for an extended period of time, and they should immobilize the head and neck movement while allowing for normal daily activities. It is provide more immobilization in the sagittal and transverse planes compared with soft collars. Philadelphia collar. This is a more rigid, stiff collar that has a front and back piece that attach with Velcro on the side. It is usually worn 24 hours a day until your physician instructs you to remove it. This collar is used for conditions such as a relatively stable cervical upper spine fracture, cervical fusion surgery, or a cervical strain. Another similar type is the Miami cervical brace. Hollow braces. Its main purpose is to immobilize the head and neck. This is the most rigid of the cervical braces. It is only used after a complex cervical spine surgery or if there is an unstable cervical fracture. The hollow looks a lot like the word sounds. It has a titanium ring hollow that goes around your head, secured to the skull by 4 metal pins. The ring then attached by 4 bars to a vest that is worn on the chest. The vest offers the weight to hold the ring and neck steadily in place. The hollow is worn 24 hours a day until the spine injury heals. The next is the trochanteric belt. Is usually prescribed for sacroiliac joint pain or pelvic fractures. The belt fits around the pelvis between the trochanter, a bony portion below the neck of your thigh bone, and the iliac pelvis ridge crest. It is about 5 to 8 centimeters wide and it buckles in front just like a regular belt. The sacroiliac belt is used to prevent motion by putting a compressive force on the joints between the hip bone and sacrum base of the spine. The next one is the lumbosacral belt. Help to stabilize the lower back. These belts are usually made up of heavy cotton reinforced by a lightweight stays. The pressure can be adjusted through laces on the side or back of the belt. These belts range in width between 10 to 15 centimeters and 20 to 30 centimeters. The next is corsets. Braced, it provides rigidity and support for the back. Corsets can vary in length. A shorter or longer corset will be prescribed depending upon your condition. A short corset is typically used for low back pain, while a longer one is used for problems in the mid to lower thoracic spine. When people think of corset, they usually conjure up image of women from earlier centuries who used them to make their waist look smaller. Today, in the treatment of back problems, corset refers to a type of back brace that extend over the buttocks and is often held up by shoulder straps. Like the corsets of old, this lace up from the back, side, or front. There are metal stays that provide the appropriate rigidity and support for the back. Next is William brace. This type of brace has no vertical uprights in the midline so that flexion bending is allowed. The next one is chair back brace. This type immobilizes the lumbar spine in the neutral position. The chair back is designed to reduce sideways and revolving movement of the lower spine. The next one is the Rene flexion jacket. This type reduces lumbar lordosis by holding the patient in a neutral tilt. Hyperextension brace is designed to prevent excessive bending, and it is often prescribed to treat frontal compression fractures that have occurred around the junction of the thoracic and lumbar spine. The brace can also be used for post-surgery healing from a spinal fusion. These braces are support that allows anterior front pressure unloading of the thoracic vertebrae by restricting flexion bending of the thoracic and lumbar spine.